The high and rising cost of health care is a significant worry for families, workers, and employers across the country. Concerns about high premiums, high deductibles, and drug prices are known and well documented. But the issue of surprise billing has rapidly risen to the forefront of people's worries when it comes to health care. Surprise billing, sometimes called balance billing, happens when a patient visits an out-of-network care facility or even when they are at an in-network care facility, but are seen by a doctor who is not in their network. The story of surprise billings may go something like this. A worker who's having trouble breathing visits an emergency room at a hospital in his or her health insurance network. While there, they receive an x-ray of their chest, and it's seen by a doctor who prescribes medicine to ease the strain on the lungs. Following the visit, he or she gets a high bill, for the trip to the emergency room. Even though the hospital was technically in network, the doctor who saw him was not, leaving him to pay for the cost of treatment. This understandably causes frustration for individuals who thought they did everything correct. It can also cause a high degree of uncertainty and stress for workers and families as they try to find the money to pay for the health care service they believed would be handled by their insurance. According to a 2018 poll from the Kaiser Family Foundation, surprise medical bills are the leading health care concern for Americans, surpassing concerns about high premiums, high deductibles, and rising drug costs. 39% of insured working-age adults reported they had received a surprise medical bill in the past year from a doctor, hospital, or lab that they thought was covered by their insurance. Of the 39% of individuals who received surprise medical bills, 50% owed more than $500. The fear of an unexpected medical bill can be paralyzing, and we don't want Americans foregoing care they need for fear that they'll end up responsible for medical expenses that they can't afford. We need solutions that equip patients with the information they need to confidently seek treatment without the worry they'll face a huge surprise bill. About 60% of workers, or 110 million individuals, are insured through employer-sponsored health care plans under the Employee Retirement Income Security Act, ERISA. Employer-provided coverage is important to workers around the country. Employers can custom design a health care plan best suited to their workers' needs, which helps them retain their workforce and also an important recruiting tool. I just had a conversation with an employer this morning, a major employer in Detroit, who, as a result of opportunities now, has looked for additional benefits that they can supply for their employee. A 2018 study from AHIP found that over 70% of workers are satisfied with their employer-sponsored coverage. 22 states have laws addressing surprise billing. However, under ERISA, self-insured employer-sponsored plans are only subject to federal rules and protections, and state rules and regulations on health insurance do not apply. Promoting public policy solutions that allow employers to continue offering high-quality health coverage is good for employers and employees alike. That's why we're here today, to listen and learn from a variety of stakeholders about different proposals to address this serious issue. With this in mind, we recognize that any potential federal policy solution to end the practice of surprise billing must preserve important ERISA protections and ensure that self-insured plans remain subject to federal law alone. Committee Republicans are committed to pursuing policies that lower costs, expand choice, and end surprise billing for insured individuals. Workers and families deserve certainty about their health care coverage, and I look forward to discussing how we can provide a better way forward for the American people. Thank you, and I yield back.